I am Madam Sodium, hypertension's best friend. My vibe is irresistible. I'll hang with HT till the end. Before the refrigerator, you couldn't live without me. I kept food from spoiling and fed every family. Now, I'm in the doghouse? It is so unfair, but I am here to stay. I am everywhere. Hypertension is sneaky, so it's about to be lit. If you don't handle your business, your organs and your body will take the hit. So you might be wondering, why am I starting this conversation on transforming generational health with Madam Sodium, a sassy salt crystal and a known troublemaker? Here's the truth. We are in crisis. While Madam Sodium is usually a crowd favorite, she is more than just a playful character in a Dr. Dee Dee Dynamo book. I created her to help children understand the effect of salt on their health. You see, despite our medical advances, health disparities gap is still staggering. Where chronic diseases like hypertension are striking Black and brown communities earlier and harder. More heart attacks, more strokes, more kidney disease. For example, 2 miles away, in the affluent Back Bay, the life expectancy is 23 years more than right here in Roxbury. If we accept that trajectory, then the health legacy that we leave for our children is going to be dismal. But we can change this. It is time to think differently. It is time to reimagine legacy. We must start earlier, dig deeper, and disrupt the cycle by controlling the things that we can. All is not lost. We have a secret weapon, story. Stories open our eyes, they unlock our emotions, and they connect us to a shared humanity. You see, story has always been a big part of my life. I grew up in Guyana and Barbados. My mother, a teacher, my dad, a journalist. And in Guyana, we had no television, no computers, no cell phones, but we had books. We had nature. We had wild imaginations. We listened to the radio, and we told stories upon stories upon stories. You see, for me, stories are not just about entertainment. They activate us. Whether it's a story that you hear or a story that bubbles up from deep down inside. I'd like you to take 5 seconds and just close your eyes and think about a story that inspired you to do something. For me, 2 pivotal stories come to mind. In my all-girls high school, physics was not an option. Someone had decided that girls were not good at physics. When I got to college, during my first week, the pre-med advisor told me, "You are not going to get into medical school." But I did not allow those things to break me. They fueled me because, you see, the power of my story is a bridge from the impossible to the possible. And that's why I created Dr. Didi Dynamo, 9-year-old girl super surgeon, her world an explosion of fun reading, problem solving, engaging science, and positivity. You see, I felt called to write stories that would reach our children before the world told them, you can't. And why? Why does that matter? Let me show you. Come. Come with me into a first grade classroom that's lively. The atmosphere is bursting with curiosity. All eyes are on me. Black female surgeon, author, and wearing a white sequined coat, a combination that they have never seen before. Some of them touch me, like they can't quite believe that I am real. Others hug me tight, and I can see the possibilities awakening in their eyes. I read Dr. Didi Dynamo's hypertension takedown, and the room ignites. Characters leap off the page. Hypertension, Bart the blood pressure cuff, Henrietta Hart, and of course, Madam Sodium. At the end, the students and the teachers are ready to take down hypertension. Next, they make character puppets so they could tell their own stories. And one little girl chose sad Henrietta Hart, who is sick and thick from battling hypertension. I asked her why, and she said, I want to take this home to my parents so they could see what happens when you eat too much salt. Woo-wee! I mean, really? In 1 hour, one story, she got it. She learned and she understood that hypertension is like this great, massive wave that is pounding on the organs in our body. And that Madam Sodium makes it bigger, and so the heart must work harder. That story, it stuck. 3 months later, all the children in that class were still regulating their salt at home. Story is so powerful. You see, when we marry health literacy to storytelling from early, the results are transformational and life-saving. Okay, well, let's talk a little bit more about this silent killer, hypertension. Lean in. Did you know that 1.3 billion people in the world are affected by hypertension? And 50% of them don't know that they have it? In the US, 58% of Black adults have hypertension. So on average, 1 of 2 of you in this audience will have hypertension. And you know what is even more sad? Only 1 in 5 will be adequately treated. Here's a shocker. Over the last decade, hypertension in children has doubled. I'm going to say that again. Over the last decade, hypertension in children has doubled. This is no longer just an adult issue. And oh, by the way, You know where this is going to hit hardest. Predominantly Black communities, like right here in Roxbury, where complications and death rates from hypertension are 2 to 3 times higher than our white counterparts. We must fight back. We have a secret weapon: story. You see, when children read health stories, especially with their families, they learn, they laugh, they remember, put a blood pressure cuff in their hands, and they become change agents for health in their families. Now, that is legacy. If we want to change the tide of disparities like hypertension, cardiovascular disease, strokes, kidney disease, we must reimagine legacy. How do we get there? Well, guess what? I have a blueprint. The 5 E's to transform generational health through story. 1, engage early. Early intervention is life-saving. The American Academy of Pediatrics has found that when you expose children to health education by age 8, they are twice as likely to make healthy, lifelong choices. So just imagine what generations of children look like if they simply said, "Not today, Madam Sodium, not today." 2, engage with story. Knowledge is power. When our children are exposed to information, complex ideas become simple, accessible, and relatable by just telling stories. Comprehension and recall increases by 33%. Personal stories, family history also matter. Make sure that you tell them about Granddad's heart attack. There is no shame. Let's not keep secrets. It changes our lives. It saves our lives. 3, empower positive mindset. Everything starts in our minds. When children believe that they can make a difference, when they actually have agency, they are twice as likely to make good health choices. 4, enrich with ongoing learning. Learning is everything. It happens in the classroom. It happens at home. It happens in the playground. It happens here. It happens everywhere and every day. And 5, we must enlist community action. Everything is better in community. We are stronger together. Data shows that when kids take health information, when they take any sort of information home, they increase behavior, positive choices and positive behaviors increases by 25%. This is how we activate. This is how we start a movement. This is how we reimagine legacy. Today, you can take the first step. Read a health story with a child. Get a blood pressure cuff and use it. Share family history. Share your family stories. Make sure we know where we come from, what our predispositions are. That information is powerful and it is life-saving. And finally, cut back on Madam Sodium. Children, you have the power to make good health choices. Adults, you have the power to secure life-saving legacy for generations. Brothers and sisters, we can do it. We can do it. Raise your hand if you make good health choices. Raise your hand if you are a legacy builder. We are ready to take down hypertension. If you are ready to take down hypertension, say yay. Yay. Say yay. Yay. Say yay. Yay. Yes, yes, yes. Good health choices today secure life-saving legacy for tomorrow. Let the transformation begin right now. And don't come for me now. Y'all don't come for me. Madam Seldom, over and out.